478. That is Ontario's new COVID case count, the highest daily increase in more than 4 months. It's no wonder Doug Ford appeared somber as he released the first part of his fall pandemic plan, which critics say isn't nearly enough to combat what Doug Ford says could be coming.
With the number of cases on the rise, it's clear that the next wave, it will come at us harder than the last one. It will be more challenging than before because the flu season is starting soon and people are heading indoors again.
So part one of the government's plan is to launch what it calls the largest flu immunization campaign in the province's history to try and stop the combination of COVID and the flu from overwhelming hospitals.
I'll be first in line, I'll get one, and I'm just encouraging every single person to get a flu shot.
Close to $70 million is being spent on 5.1 million flu vaccines, including high-dose vaccines for seniors. More will be ordered if necessary.
We have every year several thousand people who have to be hospitalized because of flu and flu complications.
The Premier promises 5 more parts of the pandemic plan are coming, including increased testing and contact management. But it's not being released all at once, he says, because he wants people to understand it.
If we just ram it down, on the table and just start rolling it all out, it's not going to be absorbed.
That argument is being criticized by the opposition.
They have a plan to have a plan, but they don't have actually a plan. And I think it's pretty insulting to suggest that after Ontarians coping with COVID-19 since the middle of March don't have the capacity to understand a multifaceted plan.
There is a definite switch in the Premier's mood from the days when Ontario's COVID numbers were falling. He acknowledged today he's concerned.
The numbers, they're climbing 500, maybe 700, maybe 1,000.
The Premier again talked about the need for Health Canada to approve a rapid antigen test. And he also said a saliva test is coming very soon.
We're rolling that in this week to three hospitals, Women's College and UHN and Sinai.
So that's really interesting. Just last week, BC announced it was launching a saliva test, raising questions as to why Ontario appeared to be falling behind. I'm told by a government source that the test being rolled out here will be similar to BC's and certainly less invasive than the nasal swab. It will still have to go to a lab to be tested, but it does not need approval from Health Canada.